Previous studies have shown that 3 in 10 women have a displaced window of implantation. In many cases, implantation with a viable embryo fails in a healthy uterus because the embryo was transferred outside of this receptive period. Endometrial receptivity analysis, or ERA, is a diagnostic test that allows personalized embryo transfer by synchronizing the embryo with the patient's window of implantation. This test identifies the molecular receptivity status of the endometrium and the optimal time for embryo transfer. ERA is supported by 21 scientific publications and is the product of over 10 years of research and clinical trials. iGenomics has carried out a multi-center open-label randomized control trial involving 458 patients from 16 reproductive clinics worldwide. Patients undergoing IVF with blastocyst transfer at their first appointment were randomized to either personalized embryo transfer guided by ERA or to frozen embryo transfer or fresh embryo transfer. The study was aimed primarily at comparing live birth rates between the groups. Secondary objectives included cumulative live birth rates at 1-year follow-up, implantation and pregnancy rates, biochemical pregnancy loss and clinical miscarriages, ectopic pregnancy, obstetrical and neonatal outcomes, as well as cost effectiveness. The study population consisted of patients up to 37 years of age with a body mass index between 18.5 and 30 and a normal ovarian reserve undergoing IVF at their first clinic appointment. The stimulation protocol was decided by each patient's doctor and blastocyst transfer was performed on day 5 or 6. Patients using PGTA were not excluded. In the per-protocol analysis, the live birth rate in the personalized embryo transfer group increased by 14 and 11 percentage points versus frozen and fresh embryo transfer respectively. There were statistically significant improvements in cumulative live birth rate, pregnancy rate, implantation rate, and cumulative pregnancy rate in the personalized embryo transfer group versus frozen and fresh embryo transfer. Obstetrical outcomes, delivery type, and neonatal outcomes did not differ between groups. In the intention to treat analysis, the cumulative pregnancy rate at 1 year was significantly higher in the personalized embryo transfer group versus frozen and fresh transfers. In terms of live birth rate, this randomized study has demonstrated that personalized embryo transfer is superior to the conventional frozen embryo transfer method, with an increase in the live birth rate of 14 percentage points in patients at their first appointment. There was also an increase of 16 percentage points after 1 year. Similarly, personalized embryo transfer increased the pregnancy rate by 18 percentage points and 14 percentage points versus frozen and fresh embryo transfer, respectively. Patients often undergo multiple failures before additional investigations occur. This study shows that performing ERA in a patient's first IVF cycle significantly improves her chances of having a baby.